It is within us. It's deadly, yet preventable.
I'm a cancer survivor, gone through 2 cancers. First cancer, it was cancer of the cervix, 1993.
From the time my dad died in 2013, I had that problem, and therefore I kept going for checkups.
This is a preventable disease that causes death due to lack of awareness, inadequate diagnostic and treatment facilities, as well as high poverty levels.
Exactly 20 years after the first cancer, I had a pain in the breast. When the mammogram was done, well, I was told that I have cancer of the breast.
Globally, approximately 500,000 new cases result into 250,000 deaths each year, meaning 1 woman dies of cervical cancer every 2 minutes.
That cancer now is here. Either we have discovered it, or we got a better ways of diagnosing it, or our lifestyles has changed, and therefore the prevalence has gone up. And therefore, indeed, Your Excellencies, we have to join hands.
With Africa being home to many low and middle income countries, the disease burden among women is too much to bear. Access to cervical cancer screening and treatment are packages too costly for the ordinary woman to afford.
I spent about 700,000. How many women? How many? The woman there at the grassroots, ule akoko nyumbani mashinani, atatoa wapi hiyo pesa?
And I needed 3 million almost. So
Although urgent mitigation is required, there exist serious gaps in funding for health programs, with most African governments focusing more on infrastructure and recurrent expenditure budgets. African First Ladies, cognizant of this challenge, have taken it upon themselves to mobilize efforts and procure partnerships to address the reproductive health gaps.
As I launch the 9th Stop Cervical Cancer Conference in Africa, I wish to suggest that there's a silver lining despite the grim cancer statistics.
Here in Kenya, First Lady Margaret Kenyatta has pushed this urgent agenda even further. Through the Beyond Zero initiative, she has intensified her cervical cancer awareness campaign to ensure that this silent epidemic among Kenyan women is dealt with so that no woman would die from a preventable condition.
I have to do this. I have to do this for Kenya.
She continues to traverse different parts of the country and the world using sports as a platform on which she has raised funds to purchase mobile clinics for each of the 47 counties of the Republic of Kenya. The results are impressive. Every county in Kenya is feeling the great impact of her noble cause. Her emphasis is that women aged between 18 and 69 years and who have ever had sexual intercourse need to undergo regular tests as the best tool to detect the likelihood of developing cervical cancer. Mama Margaret also advocates for vaccination against the human papilloma virus to help prevent the risk of contracting the disease. The Beyond Zero campaign has already delivered over 30 and continues to give fully kitted mobile clinics to facilitate access to care for patients. Each of these facilities is valued at more than $150,000 US. From the highlands of Kenya to the lower parts of the country. From the lake basin to the coastal region. These fully kitted Beyond Zero mobile clinics are traversing Kenya's beautiful landscape, inspiring action and changing lives.
Beyond Zero.
The women are now feeling the motivation and appreciate the importance of visiting the mobile clinics for screening, some being encouraged by their spouses, a fact that underscores the critical importance of male involvement in reproductive health issues.
Nilimwambia mama hata mimi ndo mbebe mtoto leo nipeleke pale kwa sababu nilisikia furaha sana kwa moyo wangu.
Na sijawahi kuona mbeleni gari imekuwa ndani ni nyumba ya kupimwa na kuwa maternity ya kuzalisha.
Looking at the equipments that are available in the Beyond Zero, people are receiving so many services there. Yeah, so we've really improved the outreach services.
What I would request the donors and the First Lady, maybe if we get more mobile clinics, we'll be able to reach more people than we are reaching now.
But one question abounds. Have you taken the step to be screened?
At least twice a year, you need to go for checkups, go for screening, have your breast checks, have your cervix check.
If it is detected early, then you need not to worry. You'll be treated and you'll be well.
Ni lazima niweze kupimwa ili nikaweze kujua hali yangu ya kansa ili nikaweze kutibiwa.
And so, as Kenya's First Lady Margaret Kenyatta forges on and on with her pursuit of the vision to reduce the number of women dying of cervical cancer and other preventable health conditions, her conviction remains that this is a destiny we must all endeavor to reach. Because
it's possible to go beyond zero.